All, this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show, the second show for today, and we are going to have our random chit chat. So Jana Taylor and Ruby's are red. They both say they're first. Jana didn't say it actually. Jana said hi. Ruby said first. So welcome. Jim is here as well. Um, okay, cool. So Siddhartha, hello. How are you? Kamran, hello. DDS, hello. Jenna says hi. Ruby's Carolyn, we are back. Welcome back. Nancy. And there are so many folks. Now I cannot even go and uh, click on everyone. Jamie, you're very welcome. So I think that unknowingly, something that I had been doing in the past is to add steroids later on during the phase of the disease have been very important. And I think that aggressive treatment in the beginning, where you don't actually let a person sit at home and recover, that part is also very important. So I believe prophylaxis is very important. Correct treatment at the early phase is very important. Correct usage of steroids are very important. And then at the end of the disease, if it starts continuing as a long hauler, then steroid pulses are very important as well. Okay, so hey France, how are you? Walaikum salam. Thank you very much. Love you too. Barbara, Lotus and I are back, but she's asleep on my left hand. Lol. Sorry about that. Luffy's just running around here. So zinc and quercetin, absolutely. So I think I just missed it. So zinc and quercetin part of the prophylaxis as well. Yes. Paul says, are there larger percentage of women in long hauler status in the following categories: pre-pubescent, fertile, post-menopausal, post-hysterectomy? This might indicate why women are 80%. So they do not have that breakdown in that study. It will be very interesting to see, because many times if it is because of the immune system or hormones, usually after the menopause, then the distribution becomes equal. So very, very good point. Kamran says, if virus is hiding and sitting at some place, how come immune system can't find it? If it can't find it, how does it know that the virus is somewhere? So very, very good question. So there are certain sites in our body that are called immune privileged site. For example, testis is one in men, or brain is an immune privileged site as well. And there are many more. The idea of the immune privileged site is that the virus can sit there, or pathogen can sit there and be ignored. We do not want the fire in those areas, because if there is inflammation there, then it is going to cause damage to the tissue as well. So let's say testis or brain. So immune privilege simply means we ignore them, we suppress the immune system there. Now, if a virus is sitting there and it is replicating there, imagine if it is doing that, then it can just keep coming out of that place and back into the bloodstream and keep causing the immune system to be dysregulated or bothered or triggered. So it is not that if, let's say, the virus is sitting in the testis, then somehow immune system is going there and getting mad, because it is not, immune system is not allowed to do that. But when the virus is sitting there and is able to replicate, it is going to come out. And when it is going to come back out in the other tissues, then our immune system is going to respond. So that area becomes a continuous source of the virus. So Debbie says, virus and immune reaction, irritating nerves. As virus reduces, the symptoms go away. It's not damage per se. No. Maybe that the virus is in such low levels that when the immune system is present, it only irritates the nerves. Usually irritation does mean damage. So let's say that irritation here means some local sodium channel or calcium channel dysregulation, some ATP dysregulation, some myelin sheath function issues. That still can end up in damage. But let's say if it is not to that level, then yes, it is possible that one can get symptoms that are cycling. Samantha says, what is considered a long hauler rather than still active COVID? So look, it is possible that if the situation is that when the RT-PCR is negative, but the patient still continues to have the symptoms, we say that now the virus is not there, but they are still in long hauling. Maybe the virus is there. And if that is the case, they are inactive COVID. It says that they are in a carrier state now. William says, as far as prescription medications, do you believe the standard of care should be ivermectin and fluvoxamine given from initial diagnosis, and then in addition, steroid given day 6, 7? Yes. Fluvoxamine, I'm a little more hesitant because of its side effects. It has a very narrow margin, but of course, we administer that to many patients, so it just has to be really correctly given. But yes. Jenna says, good night and love to all. Not feeling great, back to sleep. I go to my long haulers. Never give up. Thank you for everyone. Jenna, good night. Jenna, I was very curious that you are taking ivermectin. How is that done? Sepal Steve says, long hauler for greater than 10 months, would ivermectin help at all? Yes. So again, as we looked at the rationale, if the long hauling is occurring because of the virus sitting somewhere hiding, for example, in testis, which I think is not possible, but let's say in testis or in monocytes or in some other cells, brain tissue, which is totally less possible. But anyways, let's assume that the virus is sitting somewhere. Then ivermectin will help reduce the virus numbers. If it is the immune system that has gotten a hit and run and the virus is not there, then steroids will help. So that means a combination of these things have to be done. If it is just the brain tissues, lymphatics and pressure issues, then fluvoxamine like things would help. So I think we will have to test. So ideally, if you wanted to understand what is going on other than the labs, one can start with one drug at a time, ivermectin, and then see the results. If that doesn't help, then steroid and see the results. So that is how one can go up the scale and see which drug is working, and then see what is the mechanism of that drug, and then from there hypothesize that what was happening in the patient. Nina, it's not about the stress. Of course, stress is one part of that as well, because stress would cause adrenaline and steroids to be released, which would then block the immune system's behavior to correct itself. But at the same time, women have hormones and the immune system's propensity to attack more. Their estrogen, progesterone help with the immune system's activity, plus their immune systems are generally a little more active than men. Jody says, plasmas jump on inflammation after viral infection. They cause misery in many parts of the body. Would like to know if long-term antibiotic use like doxy or zithro can cure many of these symptoms. They can. And please see that. I would actually recommend that you read Chronic, the book from Dr. Stephen Phillips, and you would see a lot of interesting things in there. On that point, this Thursday, I believe Dr. Pierre Corey would be with us. And in March, we would have Dr. Stephen Phillips come back as well. So if you have any questions for him, that would be interesting to ask him. Elizabeth says, budesonide on day 7 of infection, for example, yes, it is useful, but budesonide is mostly contained to the respiratory tissue. I think systemic steroids, low dose, like delta cortril like things, low dose for 4 or 5 days should be given to keep the immune system in check. What are your thoughts on budesonide taken after COVID infection, even if you have mild symptoms? Yes, so again, you can take it, but as I said, it is local. Jim says, after vaccination, does it make sense to take only DC, melatonin, quercetin, zinc? If not, what would you add? So after vaccination, ideally from the virus, you are generally good. But uh, of course, our vitamin C, D, melatonin, quercetin, zinc should always be there. These should just be simple habits for us. Jim's same question again. Gum disease and worse outcomes. Micaveli, gum disease, again, there are so many kinds of gum diseases, but possible that if we are talking about the gums that are bleeding and those that is an indication of vitamin C deficiency, if that is the case, it is possible that more infections can occur. You're welcome. You're welcome. Gino says hydroxychloroquine versus ivermectin. Ivermectin is way more versatile plus safe. Hydroxychloroquine is great as well. I am a pro hydroxy and pro ivermectin guy. Isaac Roger says ivermectin seems to have caused significant fat atrophy in my body. Apparently, inhibits certain genes that influence the adipocytes. Before the drug, I never had abs. Now I do. It's very weird and worrying. Is it worrying because you have lost too much, or I do not know what is the relationship of ivermectin, and I do not know what is your frequency and dose. But that is an interesting thing to look into. Loop duplicate. Where in the body besides the brain are sigma 1 receptors found? I was a long hauler for 10 months. I've been on fluvoxamine for 3 weeks. Now every one of my symptoms are gone from head to toe. So sigma 1 are present in every cell. So fluvoxamine can actually help everywhere. This is great to know. There are so many reports of fluvoxamine helping a lot in long haulers. Mr. J says, is there still much we don't know about the virus, or have we pretty much mapped out its course of attack? We have. What we have not understood yet is how our body is responding. For example, those people who have CCR5 heterozygous, they are responding with less intensity. They're becoming less long haulers as well. So what is our body's behavior? And everybody is behaving slightly differently. That is the interesting part. Denise says, my body fat went down and feel much more solid after. Very interesting. I did not know this part of the ivermectin. I take hydroxychloroquine. Nancy says, I take hydroxychloroquine for my rheumatoid arthritis. Should I add ivermectin for my long hauler? Please talk with your doctor and try ivermectin and fluvoxamine. But again, after talking with your doctor and with the correct dosage and correct frequency and correct duration. Jim says, can quercetin take the place of NSE glutathione? Quercetin is not a very good antioxidant, but if you wanted to not have NSE and glutathione, then vitamin C itself is good antioxidant. And then if you're taking CoQ10, that is also good. So you can drop these. Samantha says, and ivermectin or fluvoxamine, both. So ivermectin is important for the body. Fluvoxamine is important for the brain tissue. Should we be taking copper with our zinc? Yes. Rima says, Machiavelli says, sorry, I was going to click on Rima's. Even mild cases show extensive lung damage on X-ray. That, and again, we'll talk with Dr. Corey. He's going to be specifically talking about organizing pneumonia and COVID on this Thursday. But it is possible that the pneumonia that is atypical, which then becomes typical, would show up as a weird stage, but usually it resolves. If it organizes, that means if it becomes permanent, the fibrosis from it, then that is a problem. Rima says, young person got COVID, then got pneumonia. now testing negative to COVID, but still weak, sick, breathing issues, and the doctor says pneumonia. No one is even discussing long hauler. Um, I looked at her and I was very concerned. I'm in a PA with the docs there just aren't clued in. What labs should I suggest she get? Would an extra show a difference? So the most important thing is to get their X-rays and the chest CTs, high definition. So that would tell you what's happening inside the chest. And then there are, for the infections, bacterial or other, there are various labs for that as well. Interesting that doctors are, no worries. Nina says, dang, I was watching wrong video on TV. Right. Susan says, question, what's your take on celecoxib 100 milligram for inflammation and migraines? Very specific question. It is good, but hypothetically it is good. You're welcome. Eric the dog says, if no one visits you in hospital, old people home, it is recorded. Question, so why should staff care if you die? Nobody will protest. Yeah, that is sad. I hope that doesn't happen, Eric. Eva says, why is post-COVID syndrome affecting more people with weak connective tissue, hypermobility, Ehlers-Danlos syndrome? I did not know that. So this is something I'll have to look up. Samantha says, I hear you say specific amount. Is there a way to find the recommended amounts needed for a doctor that doesn't know? Usually, if you look at I usually consult Goodman-Gilman, although there are many online good pharmaceutical sites as well that give you various doses. I always go to the textbooks because they have the most carefully selected doses. So look at Goodman-Gilman, and there are doses there. Patricia says, been hearing about headache and nauseous within minutes, but gone in 3 hours. Is this new? All people immune boosted, not tested because symptoms stopped. All are fine. Yes, so headache and nausea is part of the long COVID as well. So I do not know if you're talking about long or acute, but it is possible. Sigma 1 is really good. So the fluvoxamine or other Sigma 1 agonists are really good. Me says, question, people in South America are using colchicine and aspirin on top of ivermectin. What do you think about it? That is fine. It's just that just be careful with the side effects. But these are good. Jim had a question. Do you recommend ASA post-vaccination? Yes, if it is not contraindicated. Zakir Khan says, is it safe to have China vaccine? There are many vaccines from China, so it depends which one. We talked about Sinopharm. I think that has been okay from whatever data I could collect. I still have to talk about CanSino, but I would talk about it after this week. This week we're going to talk about long haulers. Rima says, Dr. Bean, your skin is flawless. I'm watching on my PC instead of my iPhone. Thank you very much. Question, could long haulers have it in their appendix? Difficult to have it there because for appendix to become the host of these things, the infection first has to be brought into the appendix, usually on the food particles. Then, so it looks rare, but maybe because we do not really know where it is. Patricia says, no one has ever tested positive to COVID-19. Not one. Is that a question or a comment? Nikki says, would you recommend taking the AstraZeneca vaccine? That is the only option I have right now. Yeah, so it works fine. I have my own concerns from their data point of view, but it still is valuable. Titan says, Dr. Bean, I'm 15 years old and I have sperm leakage problem when I was sleeping. You don't need medicine for that. David Rogers, a lot of information on effectiveness of vaccine, but not much on Moderna. A lot of information on effective vaccine, but not much on Moderna. This is the one that I will be taking the second jab tomorrow. Moderna is very good, 94% effective. And with the new variant, I think they said somewhere in 80s range, but still effective. Elizabeth says, I'm not sure if ivermectin is supposed to help with the pain syndromes, but it has helped me because it reduces the inflammation. So it is a good thing, actually. Frankie says, Dr. Bean is eating a lot of fruit and veggies. Can't you see? Thank you. I am gaining weight nowadays, sitting at home all the time. Jenna, hey Jenna, you back? Lol, Wayne, I stuck around but said just going to listen. But Wayne, you just had to needed the law. Hey Jenna, Jenna, I'm still curious about your ivermectin usage. Um, Jim says, question: can COVID cause UTI from attacking the kidneys? No. So there is no, in the milder cases, when somebody is in a severe state and then they are moving towards uh, passing away by a disease, then all tissues are open uh, areas for the virus to go everywhere and cause harm. And then septic, the blood pressure changes and low blood volume and low blood pressure and the ischemic situation. And so that is different. But in a normal person, usually kidney do not get infected by it. Um, um, Shashank says, do pet need to be given ivermectin? Has Luffy received ivermectin? Not yet, but that I need ivermectin for Luffy. Nancy says, for long haulers, is the ivermectin dose the same as a prophylactic dose? Um, because ivermectin's dosage has not been really seen for these kind of situations, what I have been doing is prophylaxis weekly, one dose, during the disease continuously daily. And fortunately, touch wood, I don't want to jinx it, I never had any of my patient become long hauler except one. There were a couple of more, but they gave the steroid pulses and they came out of it. One person became a long hauler. I gave the steroid pulse. They improved a little bit. Then 2.5 months later, they still had the symptoms. And I gave one more steroid pulse and they improved and are okay now. So I haven't tried ivermectin. I would suspect that for a long hauler, ivermectin should be similar as in prophylaxis. Naihu says, yeah, very nice skin. What kind of diet does Dr. Bean take? David Rogers. So this, I think I just talked about it. Let's see what is latest here. Jim says, how important are curcumin, black seed oil, honey? I take them. Black seed oil and honey very often. Curcumin is part of our regular food as well. So I believe in these very much. Mr. J says, what happened to all the mink concerns? Did we decide it was a big deal? I think it was not. Ankar says, my doctor won't prescribe me colchicine. How do we find a doctor around Cupertino? There are many doctors in Cupertino. This is very interesting. So do a telehealth visit for scabies. So Denise, I'm going to talk about the MCAS as well, mast cell activation syndrome as well, and MAS as well. So Saper Steve says, will you be covering any new meds approved for COVID treatment in the future? No of any at the present time, just curious. So we did talk about bamlanivimab. Let me actually, with you, look at the drugs. I don't think they approved anything new, but let's see. 1 second. So if we say FDA approved drugs for COVID, I hope this would get me there. Testing, medical, surgical, mass 3D, manufacturing, supply chain, drug inspections, food and safety, animal food, face mask, general. I may have to go and search it. So what I'll do is I'll search and see what else is there. The last time when I checked, they had approved bamlanivimab as well. Drugs. Learn more about drug review process. Approved drugs for COVID. Program. This may be it. Trials reviewed. So these 8 treatments currently authorized. Let's see if I can get to them. So the categories in which they've done are antiviral, immunomodulator, cell therapy, gene therapy. Usually I have to go find a little bit before we can see them. This is okay, so I'll have to find them. I'm sure there is a link somewhere on this page that brings us to the page where they have the approved drugs. Interestingly, they don't have clickable. Oh, there. So we are here. Let's see. So these are, so look at this, 9th February, bamlanivimab, then Moderna's vaccine, Pfizer's vaccine, Regeneron's polyclonal antibodies, baricitinib or remdesivir, bamlanivimab, convalescent plasma, Regicort for the replacement solution, and these are all remdesivir. So nothing new. Yeah, so nothing new. The last I saw was bamlanivimab, and that is where they are at. Sorry, I went over there. And Debbie says, question, please comment on treating virus with interferon alpha, beta, lambda interferon inducers such as cycloferon. Okay, so why not we take that as one of the long hauler days discussion for interferons. Interferons have been very useful to help with the viruses. Yes, India is winning. I saw Anthony's. Yes, India is winning. Remdesivir is the only approved treatment as far as I know. So these are all EUA. None of them is actually approved. So if you see here, I just had that list from FDA. All of them are EUAs, because if they approve something, then that would be the final thing. So if you see here, this is FDA's site, and over here, drug and biological products that they have given EUA to. So date of first EUA issuance, Feb 9, bamlanivimab, then Moderna's vaccine, then Pfizer's vaccine, then Regeneron, polyclonal antibodies, baricitinib, bamlanivimab, convalescent plasma, um, anticoagulants, and then this is the sedation drug and remdesivir. This is it, and they're all EUAs. They're none of them is actually approved. If they approve it, then they have to stop giving EUAs to others. So Random Web VAB says, does immunosuppressants dilute offset the effectiveness of the vaccine? Depends how much immunosuppression. If we have eliminated the immune system, then of course a vaccine is not going to help. But if it is just immunosuppression enough to temper it from overactive immune system, then a vaccine will work fine. Jenna says, I got costochondritis with COVID and pneumonia, but I really have it now in a few months. Okay. Michelle says, Dr. Bean, do you think all COVID patients should receive a steroid pulse after 8 days? Yes, I do that for my patients. Because I'm always afraid of them getting into this long haul state. So I always pulse them. A Simple Garden says, wanted to give you an update. Doctor could not prescribe fluvoxamine, but have fluoxetine. They are kind of the same, similar. Incredible improvement to breathing and sleep and overall wellness feel. Because both of them, fluoxetine or fluvoxamine, they both are sigma-1 agonist as well. This is great to know that you have better stamina, better sleep. So that means it is working. Absolutely. So Mike says the right thing. Hit the like button. This is interesting that Mike is saying 261 in the room and only 51 likes. Thank you, France. Adam says, I got COVID on 1/5, January 5th, and tested positive on 1/11, 2/6 and 2/20 from 1/11. I started vitamin C, zinc, famotidine, melatonin. Then around 1/28, I added quercetin and aspirin. Then 2/4 added ivermectin. No, this is it. Don't add more. Ivermectin is the good one. Keep your vitamin D in a good state. Texas says, how to find knowledgeable doctors, a real problem. That is actually a real problem. I'm going to talk with a Dr. Syed Heather, who has been known to be giving ivermectin if he feels necessary. I have a call with him on, I think, tomorrow or day after, because I wanted to understand why is he more open and what is his point of view. He was saying that he watched some of my videos and some of the patients said, Mubin talked about you, and then they reached there. There have been someone who has been tweeting his email address as well. So I actually use that email address to send him an email. So there are some doctors who are doing it, and then others who are who don't care. They actually, from what I heard from my wife today, that she said, when I said she went to an ophthalmologist, and she said I took some supplements, so I had asked her to take some supplements, and that has improved my eyes. She had dry eyes, and she said he shrugged and said, well, they don't do anything, but if it psychologically make you happy, then fine. This is horrible. You're very welcome. Frankie says, yes, diaphragmatic breathing helps lymphatic flow. Very, very true. Very good. Denise says, yes, tell Dr. Heather I said hello. Okay, I will do that. I think I have a call with him tomorrow or day after. Jim says, for 12-year-old, does ivermectin plus vitamin C make sense for prophylaxis? It does. Most of the time, children in this stage are actually they can handle this very well. But again, prophylaxis, I would not give prophylaxis on weekly basis. Bi-weekly is what FLCCC does. I would kind of stick to that. Laura says, I have issues, not major ones, with kidneys and liver, so I can't take the high dose. William says, question, as far as steroids given, do you prefer dexamethasone or methylprednisolone? I actually, dexamethasone if somebody is in a severe state. I think that methylprednisolone is actually better because it has better lung penetration. But if somebody has reached that point that they need steroids, then Dexa is going to be very, very potent as well. But for the outpatients, I usually just give Delta Cortril, which is even milder. 77. So good. Thank you for keeping track of it. Zigzag says, people do not blink regularly when watching computer screen, causing dry eye, just over-the-counter artificial tears. Yes, she has been using them, but now it has become a little more. So she had been taking over-the-counter tears, and now she has reached a point where these have become insufficient. So one, she was given goggles to wear at night that keep the moisture in. And secondly, today she got some prescription. I have to yet see what was her prescription, but these are more potent tears. And then there is a procedure as well where what they do is they kind of massage the lacrimal glands, which are here, but they massage some glands here as well. And then that helps with the duct and production of the tears for 1 year. And then it's a yearly procedure. We'll see. $100 now. Very good. Thank you, guys. I love you all. Whoever is liking, I love them even more. Okay, so Denise says your wife's ophthalmologist needs to retire acting that way to a patient and not realizing we're constantly learning. Yes, and not realizing that she's going to go back to her doctor husband and tell him what happened. I will talk with her for the supplements as well. So these were the regular supplements. The important thing for the supplements that I had been asking her was to keep the black seed oil, although she doesn't like it, but she takes it, honey, vitamin C, vitamin D, vitamin K2, calcium, magnesium, and then there are a couple of more. I'll get you the list that she is taking. But of course, she is still seeking help. That means it worked for some time, and then that is less as well. Sayed says, I am in brain fog for the past 7 months. I can't concentrate on my studies. How to stop? So is it because of the COVID or just in general? Zigzag says, I'll hit that the first thing. Thank you very much. John says 102 likes. Thank you, guys. There are 306 people. So thank you very much for 102 likes. Thank you. Harris says, I recently spoke to a doctor about ivermectin, and he stated that he is concerned that it requires a 10x the normal dose for its antiviral effects in COVID. Is it really 10x that 0.2 milligram per? No. So that day, Dr. Paul Marek talked about it as well. What happened was the first study that came in from Australia. In that study, they had used 10 times the drug amount on the in vitro cells in the dish cells, petri dish cells. And then they came back and they said, well, the virus went away in 48 hours. Those who do not want to use ivermectin, including NIH-like folks, They used that study to say that they had used 10 times the potency of the normal usage. What they continue to ignore, I think deliberately, is that since then there have been tons of studies that show normal therapeutic usage has been very beneficial as well. So normal therapeutic dose is 150 to 200 microgram per kilogram body weight. The only problem that we have to kind of look at is that dose is administered once a 3 months or 6 months or a year for deworming. Nowadays, we're giving it, let's say, twice a month, or in my case, for example, four times a month, or when somebody is sick, then daily. So that is the difference in the dosage. It's not 10 times more. Absolutely, Colin. So, Colin is, I have a 15-year-old daughter who is now seeing a counselor after feeling so down with lockdowns. So, do we need to pay more attention to mental health now? Absolutely. And this is why things like fluvoxamine are actually helping in one more way as well, and that is helping with the psychological balances too. And it is interesting, a few days ago, remember on Valentine evening, I had done this video, What is Love, and the hormones and or the chemical substances, and discussed how one can cause them to be secreted and improve our psychological well-being. And I posted it somewhere and they rejected it, saying it is not COVID related. And then I reached out again, although then I didn't post it. I don't care if somebody doesn't want it. I reached out and I said, look, at this time, just like we have COVID deaths, and then there is another tragedy in 30% of the people that is long hauling, there is another tragedy, and that is psychological imbalances. And we have to make sure that we take care of those as well. So, yes, psychological aspects are very, very important. We adults sometimes forget that the youngsters have a greater need. Debbie says it's COVID that caused my dry eyes. Resolved. Debbie, how did it resolve? Shashank says, what is the prophylactic dose of ivermectin? I've received Oxford vaccine first dose. Should I take ivermectin? That is really a discussion between you and the doctor. The prophylactic dose, I will go from the Malaysia study. They had used, I believe, 200 microgram per kilogram of the body weight, and they had used twice. So day 1 and day 3 in 1 month, and they repeated it on monthly basis. I think so. We had done the Sjogren testing, and that is not the case. Oh, so that is Eric. Sorry, I thought it was about my wife. Anchor Verma says, recommendation for how much melatonin can be taken for insomnia for long haulers. Very simple. Take over-the-counter melatonin, then see if you get scary, vivid dreams. If that is the case, reduce the dose. Bring the dose to the point where you do not see those dreams. There is no RDA type dose other than on the label. Dr. Marek FLCCC does have a dose prescription. You are very welcome. Yes, so we are reaching that point of having herd immunity soon. Debbie says, Dr. B, dry eye went away with the rest of COVID symptoms. I used artesunate and interferon induced cycloferon. Very good. Good to know. Thank you. Diana, thank you very much for the super chat. 2 doses of ivermectin, 18 MT twice week. Diagnosed with pneumonia, 212 on second round of steroids, D-dimer low on 212, but worried DVT before COVID, numb arms and feet numb. I fear the worst in my head. If the D-dimers are low, then you should not be afraid. And if you are outside the hospital, that is also a good thing. So just make sure that you are taking your anticoagulants, aspirin-like things, you're taking your steroids, and at least looks like you are moving in the right direction. Please keep talking with your doctor. Cool. So Island Man says, Dr. Marek says 10 milligram of melatonin and scale back if you have to. Correct. I usually say that whatever is on the um, bottle, the label dosage, and then start scaling back from there. Jenna says, night, good night, Jenna. And Jim says, what dose of ASA 81 versus 325? This is something that I would not comment on. The reason is it can be bad for someone who may be on other blood thinners, or this is contraindicated in them. So this is something that you would please talk with your doctor. Elizabeth says, I'm up to 40 milligram per night, no nightmares. Very good. Cool. So let's do a couple of more questions and then we stop as well. So here's a question from Ali G. Question: methotrexate chemo stopped 2 weeks ago. Now taking prednisolone 6 tablets stat for 5 days. Is that the 6 milligram, 5 milligram, and amoxicillin 500 milligram for 7 days? Shall I go for the vaccine or should I wait for some days? This is something that really, Ali G, you and the doctor, because what I do not know is how fast has your immune system bounced back. But as soon as you can get the vaccine is better. You are very welcome. And let's answer. So our AREDS2 for eye nutrition, yoga around eye help relax exhausted screen eye strain. I have Dr. Stuart Richard studies for AREDS. Very good. Thank you. How about last question from Anthony? Can you mention CIRS and long haulers episode, chronic inflammatory response syndrome driven by variants in HLA-DR? So yes, we can talk about it. Let me write it down before I forget. CIRS discussion in long hauler. Cool. And James, thank you very much for the super chat. This is a great community. There are more questions. So let me see if I can answer some more questions here. Island Man question: I have an appointment for blood work in 2 weeks. What should I have in addition to regular lab tests, Dr. Mubin? I would love to know the vitamin D levels for everyone. Of course, if you are concerned about anything else, so D dimers and ferritin levels and those things are good as well. But vitamin D levels are the most important. Gold Contreras says, 20 months ago, I had pneumonia and my RBCs, hemoglobin, hematocrit tested low. They are now low again. Is this a proof that I did have C19? Should I do anything? No, that is not a proof of the C19. But just keep your supplements and those things up. Nancy, thank you very much. Nairi says, Dr. Bean, can you please discuss shedding after vaccination? Okay. All right. So this is where we are at. Thank you very much. Please like, subscribe, and share. And there are links in the description if you wanted to buy me a coffee and become my patron or wanted to support this work. I would see you tomorrow.